and HHS leaders and the administration about what was actually going on in the country. Rather than saying, thank you, we will work on this, this is really helpful. As you saw, the president attacked the inspector general. HHS has the largest inspector general office in the entire federal government, 1,600 professional people who look out for fraud and waste and abuse in the big health programs, and they want to make sure that policies are being enacted that help the American public. What the report says is pretty terrifying. Hospitals don't have the equipment, don't have the testing, are scrambling and competing with one another to try and figure out what the supply chain is, and are begging the federal government for additional assistance and help.
So then why not speak to the findings and the facts and the figures in the report? Because as you said, it was an attack. It was an outrageous personal attack against the Inspector General, who was appointed by his administration, I'll say it again,
I'm sorry,
has
it's
served in government since 1999. He is constantly looking to point the fingers at the Obama administration and away from his own.
Oh my goodness.
Why?
I'm sorry.
Well, unfortunately, I've never seen a leader who is incapable of admitting a mistake. And this president has done that from the very beginning. Unfortunately, right now, that refusal is costing lives. So you appropriately played his quote at the CDC that anybody who wants a test can get a test. The tests are perfect. That could not have been further from the truth. We still don't have the testing capacity that we need. Hospitals describe situations where people are waiting 7 days for a test result, taking up a very important limited bed, taking staff time, and they may not even be positive, but hospitals can't make that judgment call. They don't have the protective equipment that personnel needs, and now only the federal government can work with the supply chain. Only the federal government can provide the logistics to distribute this equitably and carefully across the country, not to have governors try to compete with one another and compete with their own hospital systems. That's the craziest system I've ever heard of in my life.
Well, I mentioned your role in H1N1. And, President Trump taking a swipe at the Obama administration for how it handled H1N1, claiming no one saw this coming. I want you to listen to this.
We took over a stockpile where the cupboard was bare and where the testing system was broken and old. We got artificially stopped by a virus that nobody ever thought possible. Take a look at the swine flu. It was a disaster. 17,000 people died. The other administration, they didn't even know. It was like they didn't even know it was here.
Yeah, again, I'll remind people, you led the H1N1 response. What really happened?
Well, it was a very different story. Again, nobody predicted this particular virus at this particular time, but the President Trump in the transition book got a briefing that a virus was likely to occur in the next administration. It was likely to come from a populated country. It was likely to travel like this. And again, SARS and MERS have evolved in the last several years, so this is not a surprise. H1N1 was a strain of the swine flu not seen since 1918, and it emerged in Mexico. Within 2 weeks of identifying it, CDC in our day was able to produce a test that was produced by the millions. Not only every state in the country had testing, so we were able to track the flu virus, but also we shared it globally across the world. We did lose almost 13,000 lives overall in the United States out of what was estimated to be 61 million people infected. Those came before we got the vaccine, but the vaccine came quickly. We set up a national vaccination program and distributed vaccine and vaccinated people across the country and shared it again with the world. So there was a period pre-vaccine where unfortunately lives were lost, but it's about 0.02% fatality rate. Too many lives, no question about it, but well lower than the common flu for a disease that hadn't been seen since 1918.
And isn't it up to him to restock the shelves, as he said, we got it, and the cupboards were bare? Shouldn't he restock the cupboards? I mean, he's been the president for almost 4 years.
That's correct. And HHS runs the national stockpile. Part of what happens, Don, is that the national stockpile, the federal government actually buys equipment, buys medicines that may never be used. We are the only purchaser because scientists are looking out over the horizon and looking at what may or may not come down the road. So there are always drugs in the stockpile that are going to need to be tossed away because they actually have overlived their shelf life. There's equipment that needs to be updated and replaced. That's the job of the federal government, to look at the stockpile, to figure out what's needed, what's missing. And even if we didn't have ample supplies to start with, from the moment in early January that this virus was spotted, stocking up, making orders, using the muscle and leverage of the federal government to make sure that we had the equipment once we dealt with this disease was the important thing to do. What we did is have an administration that denied anything was happening, that denied that there was a problem, and that did not test or restock the stockpile. So now we are in a situation where hospitals very accurately report they don't have the equipment they need. They're putting lives at risk of their healthcare providers and of patients every day.
Secretary, thank you so much. I appreciate your time. Be safe.
You bet.
Thank you. The British Prime Minister Boris Johnson